till the sun begins to sink under the weight of all of us.
All right, let's talk about endocrine disease. When we're talking about the endocrine system, we're going to focus on the pancreas, which is an organ that sits outside the stomach just along the duodenum, and it's responsible for secretion of insulin, and then of course it's related to diabetes. We have the adrenal gland, which sits on the cranial aspect of either of the kidneys, and its responsibility, its function is secreting hormones that allow the body to deal with stress and to work through stress. And then we have the thyroid gland, which is an H-shaped organ that sits around the trachea. And it's important for us as RVTs to know where this thyroid gland is because we can often palpate it if it's enlarged on physical exam. So talking about each, pancreas, we're going to talk about it in regard to diabetes mellitus. The thyroid gland, we'll talk about it in regard to hypothyroidism and hyperthyroidism. And the adrenal gland, we'll talk about hyper and hypoadrenocorticism. So we'll start off today by talking about diabetes mellitus. So diabetes mellitus, it's a lack of insulin. So what insulin does in the body, essentially it is secreted by the pancreas and it helps regulate the blood glucose because the body needs blood glucose in order to have brain function and for muscles to be able to metabolize glucose. Essentially the body needs glucose for energy. But we don't want too much glucose because it can flood. It's too much for the body to handle. So we use insulin we use our pancreas to secrete insulin in order to regulate that level of blood glucose. So type 1 diabetes refers to low or no insulin. So these animals are insulin dependent. And type 2 diabetes refers to inadequate or delayed insulin. So these are often non-insulin dependent. A lot of the animals that we're going to end up working with are type 1 and they need to have insulin, but there are some animals that can get away with just a nice change in diet, so a high quality diabetic type diet. It's important to know too, so we've got diabetes mellitus that we're going to talk about today. There is another type of diabetes, it's called diabetes insipidus, and rather than it being specific to the pancreas in regard to insulin secretion, instead this is a lack of the antidiuretic hormone. So diabetes insipidus, it's much more rare than diabetes mellitus, and it has nothing to do with blood sugar. It's all to do with electrolyte balance, the level of hydration, and of course the level of the antidiuretic hormone. So dogs and cats that have diabetes insipidus, they'll come in with extreme polyuria, extreme polydipsia, and they're essentially taking in water at extraordinary amounts, and it's just diuresing. So it's continuously diuresing, so diluting everything in their body, and then they get crazy electrolyte imbalances, which create all sorts of abnormal symptoms and signs. So we won't talk about that one, but it's important to identify that that is a type of diabetes that you might come across in your clinical practice. So we're going to talk about the pancreas and its role in regard to diabetes. The pancreas, it's that little pale pink lobulated gland lying in the abdominal cavity within the loop of the duodenum. Its endocrine function is production and secretion of insulin to metabolize glucose in the body. It does have a digestive function as well, so it secretes bicarbonate to alkalinize the food, so the chyme coming out of the stomach, so that it's not acidic entering into the small intestine. But we're only going to talk about it today in regard to its endocrine function. So again, this is the pancreas, and you can see its closeness with the duodenum and with the stomach. So just a little closer picture, the purple cells here represent the beta cells which secrete insulin in response to high blood glucose. So the glucose regulation is a continuous feedback loop, which we'll talk about also in regard to thyroidism or hyperthyroidism, hypothyroidism. It's all a continuous feedback loop. So the body then identifies how much of that specific component is in the blood, which in this case we're talking about glucose, and then the body will tell the beta cells how much insulin to secrete based on that level of glucose in the blood. So clinical signs of diabetes mellitus, we've got weight loss, we have muscle wasting, increased infections, polyuria, polydipsia, polyphagia. All of these could also be clinical signs of other diseases, especially the weight loss, muscle wasting, polyuria, polydipsia. Those are also really common with hyperthyroidism, and they're also really common with kidney disease, especially in cats, but kidney disease as well. And you will see diabetes in both cats and dogs, and these are clinical signs for both. And then we'll talk about some laboratory indications that it might be diabetes rather than another ongoing primary or secondary disease. So in order to identify that it is diabetes that the animal is suffering from, we would run blood glucose and general chemistry profile as well. So quite often when these animals come in, no matter what it is, we want to run a urine and a CBC as well as a blood chemistry profile. In the blood chemistry profile, or if we're just using a glucometer, we're going to see persistent hyperglycemia. So it's important to note that hyperglycemia it varies depending on the animal, but the normal blood glucose for a dog and cat is roughly 4.4 to 6.6 millimoles per liter of glucose in the blood. So that being said, after a large meal or a dense meal or a highly caloric meal, their blood glucose can head up toward 13 or 16 millimoles. So that is technically hyperglycemia, but if we recheck that blood glucose in a couple of hours, it should be back down to the normal range. So animals that we suspect of having diabetes, they're going to have persistently high blood glucose. So that means in a couple of hours after that meal, it would maintain as a high level, and then even hours after that, it could be higher or maintain as a high level. So sometimes with these animals, we see upwards of a blood glucose reading of 22 to 32, and then in some rare cases, we get all the way up to 40, which is very, very high. So those are all abnormal, and just remembering that roughly 4.4 to 6.6 is generally accepted as the average normal range for blood glucose. We may also see, or we probably will also see, persistent glucosuria. So what's happening when the blood has too much glucose in it? It has to excrete it somehow. So over time, high blood glucose, we start to get that spillover into the urine. So essentially the urine starts taking on glucose so that it can be excreted. It's not normal otherwise for an animal to have glucosuria, so glucose in their urine. Glucosuria is pretty indicative of diabetes. Now, one thing that's important to note as well, when we're taking blood from these animals, when we have them in clinic, because of stress response, stress can often increase the level of glucose in their blood, and in extreme cases, especially prolonged stress, we might also see that spill over into their urine. So be aware of that. And we'll talk about this in regard to testing and home care. But sometimes we can get a falsely increased level of blood glucose, and it's not to do with diabetes, it might be stress. But again, once that animal's calm, a couple hours later, we should start to see that decrease back to normal levels. So when we're doing our urine testing, we're looking for glucosuria. We're going to possibly see a lowered specific gravity, and then plus or minus ketonuria. So ketones are really important to identify. They technically are in the blood in these severe cases, and then again, the blood meets that threshold where they can't handle any more ketones, and the ketones spill over into the urine to be excreted, and that's when we start seeing them on our dipstick for urine. And ketones are an acid that is a byproduct of the body digesting fat. So normally the body is going to use glucose for energy stores. When there's not enough insulin in the body and the blood glucose is too high, not enough insulin, the body goes into ketosis and it starts using up that fat instead of the normal glucose for energy. So it starts trying to eat away at the fat. It's kind of like a starvation model essentially. It starts eating away at the fat, and then when the body takes on that fat at high rates, it creates this byproduct called ketones, which is an acid, and then that enters the bloodstream. So over time, if an animal is in ketosis for a period of time, then they'll start to go into ketoacidosis, whereby the acids, so those ketones, the acidic level is too high, and their body starts shutting down because the level of acid's too high in their bloodstream. So we'll talk about ketoacidosis a little bit coming up. And then clinical chemistries that we might see with diabetes, sometimes we see an increase in alk phos, sometimes we see increased liver enzymes, hypercholesterolemia, and lipemia, so lipemic blood samples. Good news about diabetes is it does have a good success rate of being maintained. So that means that there is treatment for it. Now, some animals are better than others about getting regulated on insulin or getting regulated on a diet. So our role as RVTs is really, really important in this point because we have to talk to the owners about the overall treatment, about the frequency of testing, and about success rates. So what the success rate depends on quite often is the owner's ability to give the medication at the same time every single day and to check the blood glucose whenever they need to. So again, RVT role really important here because we're going to educate the clients about how to give certain medications and then the importance of sticking to one specific diet. So the medication that we give in most diabetic cases is insulin, and it's an injection that goes under the skin with a tiny little needle and a tiny little syringe. There are short, intermediate, or long-lasting forms of insulin, and each of these requires very specific dosing with specific syringes. So this is something that I wasn't entirely aware of when I first started out in clinic, but each brand of insulin has its own type of syringes that can be used for that insulin. And each syringe has a different, or a lot of the syringes have a different measurement of units. So we have to be extremely, extremely aware of this and extremely diligent in checking and double checking which syringes we're sending the client home with. And are they the right syringes for the type of insulin that that client has? Because if they're not, then it's almost a guarantee that the owner is going to overdose or underdose their cat or dog with insulin, which is life-threatening. Guaranteed, that's life-threatening. So for me as an RVT, I don't care how many times I've dispensed insulin and the syringes, I always, always, always show it to somebody else. So I show it to another RVT or I'll show it to a vet and say, can you just confirm that I'm giving the right box of syringes with the right insulin? Because I don't want to be the one that's responsible for giving the wrong box and having that cat or dog go into a crisis. Not ideal. Diet. So some animals can be maintained on diet. In general, if they're diabetic, we always recommend switching to a diabetic diet to give them the best chances of success. It can be wet or dry. Protein, fiber, carbohydrate levels are all regulated, and usually it's a diet that's high in fiber with complex carbohydrates, so really complex carbohydrates. This being said, we also want to look for some weight loss in those obese animals because we'll talk about the causes of diabetes in a minute. So there are diabetic diets now, and some animals are regulated perfectly fine by just maintaining a diabetic diet. However, they have to stay on this diet. They can't have extra treats, they can't have any other additives, it's got to just be the diet. There are also oral hypoglycemics, so medication that can be given orally for dogs and cats, and that is if the client absolutely has a phobia of giving needles and their animal needs insulin. So I don't see it very often, but there are some incidences whereby the client will opt for an oral hypoglycemic. Challenge with an oral hypoglycemic is we can only hope that it was given properly and that the animal absorbs all of the medication. So monitoring the disease, in general, where am I going with this? Monitoring the disease. So it can be affected by improper test manipulation, hyperglycemia intolerance, eating habits, and long-lasting insulin. So all of these 4 points can affect our success at monitoring this disease. So in some situations, we have the animal into the clinic and we are monitoring their glucose levels throughout the day. So before and then after giving insulin, how long does that insulin last for the animal? If an animal has long-lasting insulin and we're not aware of that, then our glucose monitoring can be a little bit skewed. If we've done the test incorrectly, that can change our results. If the animal has hyperglycemia tolerance, so they are hyperglycemic but they're not showing clinical signs, then that, in the first part, the owner is probably not going to bring them to us with a need for them to be monitored. So we rely on clients regularly to check for clinical signs, start letting us know if the cat or dog is sort of going downhill. Sometimes over time, the animal gets used to having a high blood glucose, which isn't good for their body, but they're just not going to be showing those clinical signs. So the owner might not bring them in. Common monitoring methods, the one that's most common, especially in the beginning and then periodically, is a glucose curve. So clinical signs is number one. Owner knows their pet best. They need to alert us when something's going wrong with their pet in regard to clinical signs. But a glucose curve, like I mentioned a minute ago, is when we bring the animal most often to the clinic, we feed them, we give them their insulin, and then we check their sugar, their blood glucose levels before and then after insulin at intervals throughout the day. And what that is telling the doctor is how well that insulin is working for that animal, if the insulin is peaking at a certain point, or if it's not working enough, if they need to increase their doses of insulin. So it gives a curve as to how well that blood glucose is regulated throughout the day based on the insulin dose. Good thing about that is if we have them in clinic, we know that the RVTs are doing the testing and there's not going to be a lot of technical error with that. We have a little bit more control over the actual testing itself. The downside to glucose curves in clinic is stressful animals. So animals that are higher stress, they're not as comfortable in the clinic. We're going to get falsely elevated glucose with these animals. So it won't actually give the doctor a clear clinical picture of how well that insulin's working, because if they're stressed, their glucose in their blood is going to go up regardless. And then of course we can't tell if that is a stress response or if that's just poor regulation of blood glucose. So there is a lot of evidence to say that it's beneficial to have owners learn how to do blood glucose at home and then take intermittent blood glucose readings and also do the periodic blood glucose curve. I do find a lot of doctors don't like owners doing it at their home. I think they worry a lot about technical error. So, are the owners actually taking the blood properly? Are they reading the test properly? Are they setting it up properly? But in the end, if it's lower stress on the animal and we have owners who are truly able to complete the test accurately at home, I think that would be the most ideal to get the most accurate readings. Fructosamine. So, fructosamine is a blood chemistry test that we send off normally once a year or so, but especially in the beginning when we're establishing doses of insulin for the animal, so when the doctor is establishing doses of insulin. And fructosamine essentially gives an indication of how the glucose has been over the last few weeks. So, instead of just a snapshot about right here, right now, with blood glucose, fructosamine gives an overall understanding of how glucose has been in the body over the last few weeks. Urine tests are also beneficial to run. Now, sometimes too, we'll send clients home with urine tests and they'll be able to put like no sorb or what's that other one? Lab litter. There's another one. Kit for cat. All those urine collection agents. They can put that in the litter box and then just dunk the dip strip to try to see if there's glucose in the urine and if there are ketones. So that's kind of an easy thing that clients can do at home. But again, technical error, they have to time it appropriately, etc. There's many test strips available. So it is something we can do in clinic, but it's also something that's really easy for clients to do at home too. So blood glucose, this is typically what a glucose curve looks like when we do it in clinic. So we will feed the animal and then give the injection of insulin and then measure, normally it's every 2 to 3 hours over the course of a day, to see how low the blood glucose goes and then at what point it starts creeping back up. It should be essentially a 12-hour curve because we're giving insulin every 12 hours for most animals. Really important here, really, really important that we always, 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 always feed the animal before and or during insulin administration, but definitely before. The reason for that, if we give insulin to an animal that has not eaten, then we're going to send them into hypoglycemia. And hypoglycemia is just as dangerous for the animal because they're not getting enough blood glucose to their brain. So their brain function will actually stop, and hypoglycemic animals can go into a coma. Okay, so really important when we're going through this with owners, we're going to tell them how to give the insulin. And above all, the most important, of course, is measuring the insulin, but as important is giving food before we give that insulin. Now, owners might have an animal who's sick and not doing so well, and sometimes they vomit up their food and the owner's already given the insulin. It's always advised to call the doctor, the veterinarian, or the vet hospital in those instances, but sometimes we'll advise clients to put a little bit of corn syrup onto their animal's gums, so in their mouth, to ensure that there's at least some glucose that's being absorbed in the body so that they don't dip into a huge hypoglycemic episode. Okay, so really important. And just remembering too, we play a huge role in being cheerleaders for clients, that they are able to do this at home and they can give their animal a big long life with diabetes, a long happy life with diabetes, and they can do it. And they can always call us, they can always ask for advice. Really, really important. So, urine testing, we'll just go back to this. So, ketones, we talked about ketones a little bit. So, again, ketones start to develop when the body doesn't have enough insulin and it starts to dip into its fat stores, trying to derive nutrients from fat. And then these ketones is a byproduct of destruction of fat, and it's actually an acid that's released into the bloodstream. So, the urine test strips that clients can do at home definitely can identify the presence of ketones in the urine. And then there's also this thing that clients need to be aware of if their diabetic animal isn't doing so well. Maybe they're not regulated very well, their blood glucose maintains high, they're not getting enough insulin, they're always at risk of ketoacidosis. And ketoacidosis is a condition that requires immediate veterinary care, and essentially their animal will become lethargic, vomiting, not wanting to eat because their body becomes an acidic environment. So their HCO3 is decreased, their PO2 is increased, so that's a shift away from alkaline and into the acidic environment. And we need to have a blood gas reader in order to acquire those values. These guys will also have extremely increased blood glucose, they'll have a decrease in phosphate, and they have osmotic diuresis. So essentially, their electrolytes are completely out of whack because they have an acidic environment happening in their body. So, really important, diabetes is a lot of telephone conversations with owners. If their animal is ever just not right, just not doing well, then they need to bring the animal into the clinic. That being said, too, if an animal is diabetic and is on insulin and they are undergoing a time of high stress or illness, this is the same as people, but high stress or illness, maybe a cat that's acquired an upper respiratory infection or a dog that needs to have a dental performed under anesthetic, then quite often those animals need to have their insulin increased because their body is using more glucose their body's going to be producing a lot more glucose during those times. So, a lot of times they need to have their insulin increased during times of stress or illness in order to regulate effectively. So, reasons for diabetes, of course, is genetic. There are also other factors that we can control that can lead to diabetes. So, long term steroid use. Oh, yeah, just going back to animals that have times of illness or stress. The reason that their insulin might need to be increased during those times is because the level of stress hormones in their body, so a lot of those stress coping hormones and those stress hormones will actually deactivate or counteract the insulin that the body is producing or that we're giving. So those stress hormones are starting to take an effect on their body and they're sort of deactivating or counteracting the effects of insulin. So that's why we have to increase their insulin levels in those circumstances. Likewise, animals that are on long-term steroid use, so animals that have Addison's disease or skin diseases where they need to stay on steroids for long periods of time, corticosteroids can also counteract the effects of insulin. So even if it's the body's natural own insulin, over time, it can become counteracted by the use of corticosteroids. So always take caution in animals that have long-term steroid use that they could definitely develop diabetes mellitus. Obesity also puts animals at higher risk of diabetes. So there are a couple things that we definitely, can avoid to avoid diabetes. So keeping an animal slim and trim they have lesser chances of developing diabetes mellitus over time. All right, moving on to thyroid gland diseases. So this is another endocrine disease. So we're talking about the thyroid gland, which is that little gland that hugs the trachea. And the thyroid gland is responsible for regulating metabolism in the body. And we're not just talking about weight loss and weight gain in the body, we're talking about heart rate, respiratory rate, excretion, etc. So there's a huge, huge role that metabolism plays. So the thyroid gland secretes a few hormones. T4 and T3 are similar, the same, similar at least. One of them is directly from the thyroid, and then the other we find circulating in the serum. They both technically circulate in the serum. So then we have free T4, free T3, which are non-protein bound. Essentially, the one that we're going to focus on the most is T4, which is thyroxine. So a little bit of terminology. Euthyroid is a normally functioning thyroid. Hypothyroid is a decrease in thyroid hormone production, and hyperthyroid is an increase in thyroid production or thyroid release. And we're talking about thyroid hormone, we're talking about T4, so thyroxine. How the thyroid works, just like the release of insulin based on the level of glucose that's in the body, the thyroid is a continuous feedback loop. So we have the hypothalamus, which is up in the brain, so we don't have it pictured here, but just picture hypothalamus up in the brain, releases TRH, which is thyrotrophin releasing hormone. This signals the release of TSH, so thyrotropin, or also thyroid stimulating hormone. So it signals the release of TSH into the bloodstream from the pituitary gland. Okay, so TRH reaches the pituitary gland, which is at the base of the brain. Pituitary gland says, uh-oh, based on that level of TRH, I need to release some thyroid stimulating hormone. That is released into the bloodstream. It's taken up through the thyroid gland from the bloodstream. The thyroid gland identifies how much TSH was released, and then it secretes thyroxine and T3 based on the TSH level. Okay, so now we have T3, T4 circulating in the serum, in the blood, and then that blood then again enters through the hypothalamus, through the pituitary gland, and we start that feedback loop again. So we're going to start with hypothyroidism. It's fairly common. It's the number one endocrine disease in dogs. Cats generally, overall, do not get primary hypothyroidism. If cats have hypothyroidism, it's most often due to neoplasia somewhere in the body, quite often pituitary. So cats generally don't get hypothyroidism, primary hypothyroidism. So clinical signs of hypothyroidism in dogs, it tends to make everything slower. So I always picture Eeyore from Winnie the Pooh. Everything is slower. They're kind of depressed. They're kind of fat. They kind of start to lose those fine motor skills. So on physical exam, their dermatology, we're going to start to see a dull coat, more shedding, thinning hair. They're more at risk of getting pyoderma and alopecia, so patches of baldness and skin infections. Their physical exam continued, we'll start to hear bradycardia, so decrease in heart rate. Obesity is very common when performing an ophthalmic exam. Lipid corneal deposits can be seen, and a lot of them get dry eye as well. Neurologically, in cases, especially cases that have been left hypothyroid for quite a period of time, they can start to get peripheral vestibular syndrome, so they can start to have a little bit of ataxia, a bit of a head tilt, sometimes nystagmus, but not often, but definitely ataxia can start to come on. Lower and slower motor function, laryngeal paralysis, and megaesophagus. So the laryngeal paralysis, I still don't know why it happens specifically, and I've asked around. A lot of people don't seem to know why it happens, but I didn't know that this was a common finding with hypothyroidism until I met a dog when we were doing a spay-neuter clinic, and one of our hosts asked us to come look at her dog. Her dog was old, he was fat, he was really slow, he had a really poor hair coat, and every so often he would just choke. So that was a dog that was like clinical textbook picture of hypothyroidism with secondary laryngeal paralysis. Not very much fun. Another thing that animals can get associated with severe hypothyroidism, and especially hypothyroidism that's been left for a very long period of time, This is called myxedema, and it's a swelling of the skin and underlying tissues of the face. So the way it's described, it's the harsh look of severely hypothyroid dogs. And what ends up happening, they get these angry, droopy eyebrows. So angry eyebrows, and everything's drooping. Everything looks very severe. If you Google myxedema, you'll see a whole bunch of dogs that look like this. You'll also see this guy who was a severe neglect case, and he had major hypothyroidism. And you can see here around his snout and then up on his head, he's got pretty major alopecia and little dots of alopecia throughout. So myxedema is a condition that can, there we go, a condition that comes on when it's left for quite a period of time. All right, usual suspects for hypothyroidism. Now, the ones that we most often see, I would say, are labs and golden retrievers, because in North America, those are probably the two most popular dogs, and it's also common to see hypothyroidism in them. But Dobermans, Goldens, Irish Setters, Schnauzers, Dachshund, and Cocker Spaniels are all listed as the usual suspects for hypothyroidism. It's important to note, too, it's a very slow progressing disease. So it can take years sometimes for hypothyroidism to sort of show its face in its entirety. And often we're seeing this in middle-aged to older dogs. So between 4 and 10 years old are the common ages that we start to see hypothyroidism. So it is not an age, it's not a disease of old age. It's important to know that. Diagnosing hypothyroidism, it's easy, but it's not. So there isn't one test that's accurate on its own. T4, thyroxine, is the most common test that will run in clinic. Most normal dogs will have a normal resting level of thyroxine, T4, circulating in their serum. Animals that are hypothyroidism, if we take their blood, oftentimes they have decreased hypothyroidism. But the goal here is to identify primary hypothyroidism, which we'll talk about. There's other reasons for an animal to be hypothyroid, and it's not to do with the thyroid itself. So if we take a T4 and it's low, it doesn't rule out those other causes of hypothyroidism. So it can't rule out euthyroid sick or low thyroid due to medication interactions. Sometimes we'll look for TSH as well, so we'll take a level of TSH from the blood. Quite often we take both, so it's T4, TSH. Quite often we're just running a thyroid panel, and it includes all of those. 1 in 3 hypothyroid dogs will have a normal TSH level. However, at least if they're both decreased, so if T4 and TSH are both decreased, then that rules out that euthyroid sick or medication interaction animal, because in those guys, only the T4 will be decreased because their TSH is at normal levels. So quite often, TSH and T4. The test that we used to run a lot, we used to bring the dogs into the clinic for the day, and we'd run a TSH stimulation test. So this is where we would administer a synthetic thyroid stimulating hormone intravenously and measure the T4 ahead of time, and then measure the T4 after we've administered this medication. It's no longer the gold standard, so there is potential for anaphylaxis by administering a synthetic thyroid hormone, thyroid stimulating hormone. There's limited availability of actually acquiring the TSH, and it's really, really expensive. So we tend not to do this anymore, but if you are involved in a TSH stimulation test, just know that hypothyroid animals, they won't see an increase in the T4 after administering the TSH. In normal thyroid, they will show a strong increase in T4 levels after administering TSH. So monitoring these guys, once we get them established on a medication, and the medication that we give these dogs is called, well, it's thyroxine, so it's a synthetic T4, a synthetic thyroxine, and the common name that we use is ThyroTabs, and they have like 0.3 milligram, 0.5, 0.8, etc., etc. So as an RVT, we need to always make sure that we grab the right bottle, because otherwise we can cause hyperthyroidism, which we don't want to do. So after diagnosis and after the medication has been started, we want to check the T4. So we're going to check the level immediately before the meds, and then we should check it again to see a peak level in 4 to 8 hours after the medication. This is used to tailor the medication dosage. And then after this, once we've established an ideal dosage, we're going to annually check a T4 level. So I talked a little bit about these guys, euthyroid sick patients. So euthyroid means that they have a normal functioning thyroid. So that means that the feedback loop is normal. So their hypothalamus, their pituitary gland, and their thyroid is all working together to secrete the right amount of thyroxine into the bloodstream. However, in some instances, so these particular illnesses that are listed, they can start to have negative interactions with the thyroid, and they'll actually interfere with the secretion of T4. So although although the feedback loop is working, the illness itself is having implications on the thyroid gland, and they're decreasing the amount of thyroxine that's being released. So starvation, protein energy undernutrition, severe trauma, myocardial infarction, chronic kidney disease, diabetic ketoacidosis, thermal injury, and sepsis are all illnesses that can directly affect the thyroid and create a decrease in the secretion of thyroxine into the bloodstream. So a lot of these are, I hate to say it, but like neglect cases or abuse cases where there's major trauma or neglect to like starvation to the body system. And once that's corrected, most often the animal can go back to normal and their thyroid goes back to normal. The other concern are drug interactions that can cause secondary hypothyroidism. So we talked about euthyroid sick that can cause a secondary hypothyroidism. There are certain drugs that also have the same effect on the thyroid. So a drug interaction that's very common is phenobarbital. Phenobarbital, with high dose usage and prolonged usage, it can start to cause hypothyroidism. And again, the pituitary and the hypothalamus are working properly. It's just that the drug itself is impacting the thyroid's ability to secrete the right level of thyroxine. So in those cases, they're a little bit trickier because sometimes these severely epileptic dogs need high doses of phenobarbital to survive. Theoretically, if we took them off the phenobarbital, their thyroid should go back to normal, but in most cases, they're on it because if they're not on it, they're going to be a mess of seizures. So these guys, quite often we have to treat with thyroid medication to provide synthetic thyroxine because they have to stay on the phenobarbital. It's tricky. All of this goes back to our client education and just talking to the clients. Like our role as an RVT is to talk to the clients, talk to them, give them an estimate for costs for the first year, and then an estimate for costs for ongoing. Be their cheerleader, let them know the signs to watch out for that their dog's slipping back into hypothyroidism, walk them through the tests, walk them through the medication, and answer any questions they might have. That's a huge role for us as RVTs, and I'll just keep talking about that because I think that us and our client education perspective can really make or break successful treatment of these animals. And in reality, in a lot of these animals, if we are the owner's cheerleader and teach them how to give medication, how to monitor their animal for clinical signs, that can mean life or death for a cat or dog. So we have a huge role to play in that. All right, moving on to our kitty cats. This happy little cat here. So we're going to talk about hyperthyroidism. And hyperthyroidism, again, we see it in cats. We don't often see primary hyperthyroidism in dogs. If we do, it's often a result of neoplasia somewhere in the body. Hyperthyroidism is common. It's the #1 endocrine disease in cats. And cats above 10 years old, 10% of them are expected to get hyperthyroidism. That is a lot of cats coming into your practice that have hyperthyroidism. Clinical signs for these guys, there's a lot of clinical signs. Essentially, they are creating too much thyroxine, so their body is just being flooded with thyroid hormone. So they are hyper. Their metabolism is going crazy. Their hearts are going crazy. Their respiratory rate is high. Their body's eating away at its muscle. It's using up all of its resources because the metabolism is just kept really high. So quite often we see weight loss. We see majorly increased heart rate. So even beyond stress cat in the clinic heart rate, we're talking like 180 up to almost 300. Actually, in some cats, it's 300 and above. So really, really high heart rate. Increased hunger is something that clients often report on. Polydipsia and polyuria, as well as increased activity. So some of these we have to watch out. So weight loss, polyuria, polydipsia, and muscle decrease as well. Those are also common signs with diabetes, and they're also common signs with kidney disease. And I feel like any cat around 12 years old is fair game to get any of those diseases. So then we have to put the whole clinical picture together. We have to make sure that during our physical exam, we know our normal heart rates, we know what's increased, and we're able to report that to the doctor. This can be dramatic. All of these symptoms can be dramatic, but at the same time, clients who see their animals every single day often don't notice when their animal's losing weight over time. So be forgiving with that. Sometimes it's significant. If we look at, I'll just show you a picture coming up here. So this is a cat in the top, normal cat. It was it during its normal life. And then in the picture below, it's that same cat while suffering from hyperthyroidism. So the weight loss is severe, okay? And the hair coat starts to change, starts to look a little bit ratty. But clients sometimes don't notice this, especially if it's taken their cat 6 months to get to this point. They see their cat every day. They might just start to think that this is old cat. It's 12 years old. It's starting to age. We know better. But be forgiving when clients come to you and they don't necessarily notice severe weight loss over time. So if we compare the two cats, it's the same cat. We can see the bottom cat looks dehydrated. It's got sunken eyes. It's very angular. Everything about it is very angular, whereas the cat at the top, nice roundness to it, nice round hump on its rump. As here you can start to see the bones around its pelvis. So cats, that decrease in muscle mass, we're going to really start to see around the scapula. Cats lose weight around their scapula first. They lose muscle around their scapula. Dogs lose it around their pelvis first. So we want to be on the lookout for this. Also, we want to keep our ears open to what our clients are telling us. So during the examination, during the TPR, sometimes they tell us things they don't always tell the doctor. So always keep this in mind. But they might make comments such as, I think my cat's senile, or I think my cat's going crazy. My cat is starving all the time. My cat feels great and is acting like a kitten again. I can't believe this cat's 16 years old. My cat's losing weight because it's so much more active these days. And man, this diet is finally working. Okay, if the owner thinks that this diet is finally working and their cat is going from this to this, and that's their idea of diet finally working, then I think you need to have a conversation with them about nutritional needs in cats and how cats should lose weight over time, not that quick, because that's really scary if that's their ideal. Anyways, either way, you definitely want to keep your ears open for comments like this, because these are all common findings with hyperthyroidism. I'll post this link as well. This was a document put on, was it the American Association of Feline Practitioners? It was a document that they put out, really beneficial in understanding hyperthyroidism in cats. So if you're listening to this on YouTube, I'll put it in the YouTube comments. I'll try. And otherwise, it's posted in this PowerPoint specifically for those who have the PowerPoint. So the cause of hyperthyroidism, they don't exactly know why it happens. Genetics can play a role, so Siamese and Burmese cats have a lesser chance of developing hyperthyroidism. They have also linked, so cats typically they get bilateral toxic nodular goiters, which is called Plummer's disease in humans, and that's their primary cause of hyperthyroidism. The alternative cause, which I haven't read about in cats, is called Graves' disease in humans, and it's different. So instead of getting nodules on their on their thyroid, Graves' disease is an autoimmune condition whereby the body is attacking that feedback loop. So the body is overproducing thyroid because the thyroid's not understanding the loop of TSH. So that is a completely different disease. It's autoimmune. Cats tend to get Plummer's disease. So why they get this disease, this nodular goiter disease, we don't actually know. The article that I was just talking about had some good considerations, so some things to think about. We talked about genetics, also environmental contaminants, food ingredients, plus or minus age. So some contaminants in the environment that they're talking about is there are certain additives to litter to make litter scented, cat litter scented, that have been linked to incidences of hyperthyroidism. There are even some ingredients in food that have been linked to hyperthyroidism. There's household products, things like fire retardants that are on fabrics and furniture that have been linked to cats having hyperthyroidism. All these environmental contaminants to think about, which makes me think about us as humans and, of course, what we're exposed to every single day of our lives. But that's a different conversation. Okay, so diagnosis is a consistently elevated T4 or T4 plus free T4 equilibrium dialysis. Don't worry about that. Essentially, we're going to send away a thyroid panel, and if the cats have consistently elevated T4 as well as clinical signs, then they are identified as being hyperthyroid. Okay, really important. Treatment is radioactive iodine is one treatment, and radioactive iodine is kind of like the gold standard for thyroid treatment. So how it works, the thyroid gland is the only gland in the body that will take in iodine. So it filters through iodine, and iodine gets caught within the thyroid. So what they do is we send kitty cats to a referral specialist who will provide an injection of iodine that has a radioactive isotope attached to it. And this enters the bloodstream, circulates through the blood, and then enters and sticks in the thyroid. When it accumulates in the thyroid, that radioactive component, so the radioactive isotope, then kills off the thyroid cells and destroys them, which is really interesting. And then the iodine is excreted. So that's a gold standard. The benefit is essentially it's a one-time shot to get their thyroid non-functioning or less functioning. So that's beneficial. The downside is it is a referral, and the cat has to be on lockdown for a period of time. Because we're administering a radioactive isotope, the cat typically has to stay in that clinic until all the radioactive component has been excreted. And then at home, if they're not in clinic, at home, the owner has to collect the urine, dispose of it in a biohazard way, and ensure that they're not coming into contact with any of that radioactive isotope. Because there is potential, right, that radioactivity can cause changes to our own cells. So we have to be very cautious around that. I'd say more commonly, people opt to treat with medication. So the medication is called Tapazole, is the trade name, and then methimazole is the drug name. It's administered either as a pill, which is common, normally twice a day, or as a transdermal application. So a lot of clients will opt for the transdermal application, which comes in kind of like a pen, and you twist the pen to the certain dosage of methimazole, and then apply it to the inside of the pinna of the cat's ear. A lot of people will go toward transdermal because it's easier, because they're not having to pill their cat twice a day. A lot of people, that's really hard to pill their cat twice a day. So it's good for client compliance. The downside of it is we start to get variable levels of intake. So I find what happens is we see these cats in for their T4 testing, and they have all this gross junk, this debris that's accumulated on the pinnas of their ears. Not ideal. And what's happening is we, as RVTs, need to educate the clients of how to give this transdermal medication, but also reminding them about switching the pinna for each treatment. So go from one ear and then the next ear for the next treatment. And in between treatments, actually cleaning the pinna of the ear. So actually taking that waxy substance, that remaining transdermal substance, off the ear so that it's a fresh pinna for the next application. Because otherwise, that buildup is going to prevent that medication from actually being absorbed into the skin and then into the bloodstream. Also, really important that clients should be wearing gloves anytime they're administering this medication, because if they are getting the methimazole on their hands, then of course it's going to start to enter their bloodstream and affect their thyroid as well. There's also the option for surgical thyroidectomy, which is removal of the thyroid gland. So it has a greater efficacy than the radioactive iodine, i.e., technically it works better than the radioactive iodine. But the downside is it's a very, very particular, very specific, very minute surgery that has really big implications if it's messed up. So these animals are going under anesthesia, having a major surgery around their trachea. It's kind of scary stuff. And of course, there's cost implications as well. And then lastly, some cats can be fully regulated based on a change of diet, and it's a thyroid specific diet. It's called YD through Hills. I don't know if there's any other ones other than Hills, but some cats can be maintained entirely on a thyroid diet. The downside of this is clients have to have 100% compliance, or else those cats are going to be right back to their hyperthyroid self. So again, this recommendations link here is a hyperlink if you have the PowerPoint, and it links it up to that AAFP recommendations and overall sort of current guidelines for treating hyperthyroidism in cats. So when we're monitoring these guys through when they're on medication and diet, after diagnosis, we tend to monitor a T4 every 2 to 4 weeks for the first 3 months to ensure that that thyroid medication is working or that the diet is working. Because again, the cats can only live as hyperthyroid for so long. If their heart rate is so high and they're metabolizing all their muscle, they're metabolizing all their nutrients so fast, they will die over time. They can't maintain themselves as hyperthyroid. And of course, I have a new appreciation for these cats because I myself have a condition that is hyperthyroidism. So I have Graves' disease where my immune system attacks my thyroid and I produce crazy amounts of T4, like really, really, really high levels of T4. And it is not fun. So I am not hyperthyroid right now, but I went through a period of time where I was crazy hyperthyroid and my heart rate was, once I measured it and it was 240 beats per minute. That was when I was on a treadmill, but still 240 beats per minute. That's like heart attack zone. It was really, really, really scary. And that was the day I decided, sure, okay, maybe I should go on medication for this. Anyways, I have a new appreciation for these cats. They cannot sustain a high heart rate for a prolonged period of time. So we do want to make sure that their medication is working. So we're going to check that T4, and then in a month after we've got them established on medication, and in a month after the medication we know is working, we want to make sure that the doctor checks this complete blood count and also a blood chemistry profile as well, because a lot of times kidney disease can be masked by hyperthyroidism, so it will start to show up once we've got them regulated on medication. And then every year we want to check that T4 and just make sure that they are maintaining a normal level of thyroxine in their bloodstream, and always, always, always touch base with the client about clinical signs. You know, how is Princess doing? Yeah, is she hyper again? No, she's acting normal, good stuff. Okay, so again, a lot of client education, and I think it's very valuable to give them an estimate of costs for the first year and then an estimate of costs ongoing so that you can help them make their decision and then remind them that a cat who has a hyperthyroid condition can live a totally normal, totally happy life once they're regulated on medication.
As if I'd float away.